Hello. So nice to see you guys here tonight for this lecture session hosted by SBE. I'm very excited about this presentation. It looks cool. And about listening to the coolest engineer in Denmark. We have some snacks and drinks available for you guys over here and here, so feel free to come up and help yourself. The presentation will last about 50 minutes, and then we'll have a QA session afterwards where you guys can ask Andreas some questions. But I think we'll get started with tonight's presentation, so I think I'll let you present yourself. So please welcome Andreas Lausen.
Yeah, thank you. So my intention today was to start the talk. Does it work? Well, none of this. To talk a little bit about snakebite and how it's treated with current antivenoms that are based on horses. What I'll mainly focus on is, of course, our own research in the Tropical Pharmacology Lab here at DTU Bioengineering. And then I actually intend to end my talk with sort of how is PhD/postdoc life. And this is pure branding or advertisement for continuing your studies forever. But at least give you my perspective on how it is to be a young researcher, because I think it might be relevant for you guys to know. If not, then we'll kind of skip it. And then end up off with a few pieces of advice that I think are relevant to know or think about when you're young and when you're considering a career in either science or entrepreneurship or in a company or, yeah, pretty much in any setting. So snakebite, to start out with, is considered by the WHO as the world's most neglected tropical disease. And instead of me speaking, giving you all the details, some of my collaborators have, sorry, I'm just kind of getting confused, there's resonance. Some of my collaborators have made a really nice video about it that I think we should start out with because it really explains the problem well. If I can find it. And then afterwards I'll continue with my talk.
We've seen disability. We've seen disfigurement. We've seen deprivation. We've seen destitution from snakebite.
At the moment, as a minister for this county, I am extremely worried. I'm scared. I don't know what will happen.
It's a daily reality, a race to traverse the isolated, rocky, and unforgiving terrain, all the while knowing treatment may be hours or days away.
Can you imagine the distress of running from your home, perhaps in the night, with a child on your back, suffering from snakebite, screaming in pain?
And when you finally flag down a passing vehicle in hopes of making it to the hospital, will the hospital even have the antivenom needed to save your daughter's life?
This is the only one left? Mm-hmm. You mean this is the only one left in the whole hospital?
Antivenom is very scarce. It comes and then it gets finished, then we stay without it for some time.
Every day, it's a sadness that never goes away. Your child buried next to your home. Yet another young life taken during the night. And the sister left behind met her fate from the very same cobra that slithered into their bed. Her hand now severely deformed. She is blind. She cannot walk. She will never marry. An innocent victim without the chance of a productive life. Every day, it's devastation without end. A coconut farmer in southern India who can only watch someone else climbing the trees he once climbed. Already left with nothing but years of debt, Selvarasu and his wife part with what little they have, just so they can pay to keep their children in school.
Most victims of snakebite are amongst the most impoverished levels of the community. They're nearly all agricultural workers, farmers, herdsmen, who live in a snake-infested environment. And the city dwellers may be genuinely ignorant of the plight of people who live perhaps only a few miles away and who are the food producers for the country.
It's a huge cost that you cannot imagine. But then they have to sell and dispose of all the assets that are in the family to ensure that this person is taken care of.
Okay, so the people raising their hands have been bitten by snake.
All around the world, like at this community gathering in central Kenya, the voiceless cry for help. But actually, these are the real cries. This 3-year-old Kenyan girl won't be out playing today. Instead, one of the multiple visits each and every ongoing week to treat her wound. In a few months, she'll undergo a major skin graft.
Many major health challenges of the past are now being dealt with subsidised treatments. The world has the capacity to deal with these problems. We've got neglected tropical diseases that are no longer being neglected, and that's important. But today, 342 snakebite victims across the tropics are going to be taken from their families. We know 125,000 people die each year from snakebite, and 2 to 3 times that number are left without limbs. They're maimed, disabled, or permanently disfigured. And those are the people who actually make it to a hospital to be counted. Whatever the numbers may be, the true figures go beyond any data, beyond any study. The only way you can truly understand snakebite is to walk into any hospital or any village. Everybody knows somebody who's had their lives turned upside down. Snakebite is something that they fear more than malaria or tuberculosis, or in some cases, even more than HIV/AIDS.
From Vietnam to Pakistan, from the Central African Republic to Latin America, if you color in a world map where reported death tolls and estimates are over 1,000 people per year, it's a map that quickly becomes more colorful. And if you add the countries with 50 or more deaths a year, suddenly the magnitude becomes clear.
If we are to save lives and limbs, this is the time for the whole world to wake up to this important problem that has for many years lingered with no interest.
Realistically, the best long-term strategy is to prevent snake bites, not have to treat them in the first place. We have scientists, doctors, advocates all around the world who fight for these people on a daily basis. Educating people on the ground to encourage the simple use of footwear, training rural health workers, and even teaching people that visiting a traditional healer is not necessarily of any use. And of course, we have effective and affordable antivenoms that have been developed and are making huge differences in places like West Africa, Latin America, even here in Papua New Guinea. We have the tools to make change now.
It is about time that snakebite is stopped being ignored by the world. It's a matter of human rights, it's a matter of social responsibility, it's a matter of using science for what it should be used, for the well-being of people.
Nobody should die of snakebite.
So I think that everyone in here may understand that the problem is larger than what you would have expected. In Denmark, we have about 50 bites from the European viper, or hookworm as it's called. But in all these different countries in the tropics, it's really a serious problem. And part of the problem is that they don't have antivenom. I'm just going to go through a few of the things we saw on the video. Sort of what does snake venom actually do? This is one example of I think 5-year-old girl in Kenya who's been bitten by a spitting cobra. One of the things some snake venoms do is they have cytotoxins that cause local tissue damage or necrosis. Basically, they make your flesh rot. Other examples include paralysis. A lot of the both cobras and mambas and sea snakes, they have strong neurotoxins that will inhibit your nicotinic acetylcholine receptors responsible for neuromuscular transmission, basically meaning you can't move. You get paralyzed, and your lung muscles also get paralyzed, and you end up dying of suffocation. Many viper venoms have hemotoxins that will interfere with your blood's ability to coagulate. It will either force it to coagulate, creating blood clots, or it will inhibit it from being able to coagulate, leading to internal bleeding. And an interesting set of toxins that I've worked a lot on from Black Mamba are dendrotoxins that are also neurotoxins, but that cause involuntary muscle contractions, as you can see here. And this is just a snapshot of how many different snake toxins are out there. It is by many considered the most difficult drug target known to man, basically because each snake has many different toxins causing many different effects. And as you heard from the video, the problem is quite huge. I think it's around 15 million people per year that get malaria. So snakebite is not quite up there, but it's still quite a lot. And I would personally much rather get malaria than I would be bitten by a snake. You can live with malaria. You can't always live with snakebite. And if we zoom in on sub-Saharan Africa, what really sort of makes the problem much larger is that it's very, very few victims that are actually treated with antivenom, which is the only effective treatment against snakebite. It's actually down to 1% this year. And even if you do get antivenom, another part of the problem is that antivenom is actually quite an ancient type of medicine. It's actually not even considered a drug. It's not a pharmaceutical. It's classified as a blood product. It's closer to a blood transfusion from a horse. So it's a technology that has existed for 120 years, and in brief, it starts with milking a snake. When you've got snake venom, you immunize the horse for a year or a year and a half. Then the horse's immune system builds up an immune response. It makes antibodies against the snake toxins. After this year and a half, you take blood from the horse. You separate the red blood cells from the plasma or the serum. This is what you used in the old days. This is also why antivenom is often called anti-serum. And nowadays, you do a few extra steps of trying to get rid of some of the proteins that are not antibodies, and you concentrate the antibodies and you formulate it into an antivenom. So isn't this perfect? Well, I'm sure that you can guess that that's not my opinion. I mean, it's effective in neutralizing snake venom. It works. But there are a few different issues. First of all, you're not isolating the antibodies that are therapeutically active only. You're isolating all the antibodies. And it's about maybe 10% of those that actually target snake toxins. Another issue is they're all horse antibodies. So obviously when you inject something from a horse into a human being, that creates trouble. And to put this into perspective, if you're bitten by a black mamba, which is my favorite snake, and a few other people here, it's also their favorite snake, you will need almost 50 grams dry weight of horse antibodies. And perhaps some of you might not necessarily know, is that a lot of antibodies? So if you have metastatic colorectal cancer stage 3, which is really one of the nastiest cancers you can have, you will receive about 300 milligrams of human antibodies to treat your disease. And even in this case, you actually see responses against the antibodies. So you can imagine when you have 150 times as many horse antibodies that are injected into you, you will most likely suffer from serum sickness. kidney failure, and you might even get anaphylactic shock, basically a hypoallergic reaction that you might die from. So, what are we doing about this? What we want in our group is to create recombinant antivenoms. And recombinant antivenoms, that's basically biotechnological antivenoms that consist of mixtures of selected antibodies. And while we're at it, we might just as well select human antibodies that don't cause these side effects and that are able to neutralize medically relevant snake toxins. So that's sort of the vision. And if we can do this, we will definitely lower immunogenicity. They will cause less side effects in human recipients. We can design them to have higher efficacy because we won't just have like 10% therapeutically active antibodies. We will have 100% active antibodies. We can increase half-life. We can make a much better process that doesn't have all these different production issues with going out, actually catching a snake, milking it, being dependent on a horse's immune system that it responds as you hope. And yeah, obviously when you immunize horses, you need to, every single time you make a batch of antivenom, kill a lot of mice to test does the antivenom actually work as you expect, because the process is really not standardized, and horses, they react differently from individual to individual. So what we envision is these recombinant antivenoms that are based on mixtures of human antibodies. And what people in the past have said is it's going to be ridiculously expensive because you will need to have many different cultivations for each antibody. You will need to mix them. There's so many different snake toxins. It'll be a very complex product. It'll be too expensive to produce, and so on. What we're sort of working towards is a fairly new sort of technology called oligoclonal expression, where instead of having parallel batches of monoclonal antibodies, you can actually design cells so that they either spit out a few different antibodies per cell, or that you can co-culture different cells, in our case CHO cells, in one batch, and then already make the predefined mixture. And recently we've kind of shown in one of the recent papers that if we could unlock this, if we could get there and actually find those antibodies, we could produce antivenoms probably around a cost of $30 to $150 per treatment, depending a little bit on your assumptions. We showed in another paper that per treatment you could probably be between, let's say, 50 and 300 US dollars. And that might still be quite a bit, but the current cost of antivenom in sub-Saharan Africa, which is where you can find the cheapest antivenom, it's still $1,000 for the horse one. And if we are looking even further into the future, these prices are likely to go down, and maybe you'll end up at somewhere around $20, $30, $50 per treatment, which is it makes it accessible for even the poorest of the poor in sub-Saharan Africa. So this is sort of our vision to what we want to do, and all these things have so far just been sort of theoretical. This is where we're moving towards. But in our everyday work in the lab, we do mainly two things. We look at venoms to figure out what do they consist of, which toxins do we need to neutralize with a novel antivenom, and then we also, of course, develop the antibodies. And I won't take you through all the different venoms that I've had to characterize in order to do this work, but I'll take my favorite snake again, the Black Mamba. And before actually going into the Black Mamba, I'd just like to sort of ask the question, what is snake venom actually? A lot of people, they have different perceptions of what is it and so on. And I think one of the main things that are fairly easily recognized is there's a difference between venoms and poisons. So from this day, none of you are allowed to go out and say poisonous snakes anymore. There are no poisonous snakes. Poisons are things that are toxic when you ingest them. Venoms are toxic when they are injected. Poisons may also be toxic when injected, but venoms are not toxic when ingested. So there are no poisonous snakes in the world. There are venomous snakes. A lot of people make that mistake because both in Spanish and in Danish and many other languages, we have one word for sort of venom or poisons, which is gift, which really doesn't differentiate. But if you look at it from an evolutionary viewpoint, these two systems, these two toxic systems, serve two different functions. A poison is something an animal or plant will have to avoid getting eaten. So it's a defense mechanism. Whereas a venom, that's something actually only animals, creatures, will have to subdue prey, to kill or paralyze prey, to some extent to defend themselves a little bit, but really the main driver is to kill or paralyze prey. So the fundamentals or the underlying reason for the difference is that poisons are based on small molecules, small organic compounds typically, that can be absorbed via the gut, whereas venoms are protein-based. This has the meaning also that, I mean, obviously proteins need to be injected. You can't just, if you eat them, they will get degraded in either your stomach acid or by your digestive enzymes. But it also has the effect that you actually can't make anti-poisons. You can make antivenoms because you can get antibodies to recognize proteins. It's really difficult, almost impossible, and typically impossible, to get antibodies to recognize small molecules very well. So, looking a little bit further into snake venoms in general before we jump directly to the Black Mamba, if we take an example of one of the vipers from Mexico and look at its venom, what does it consist of? You don't have to understand whatever these different things. These are just different toxin families, not individual toxins, toxin families. Within each of these pieces of pie, there is anywhere from 2, 3, up to probably 10 different toxins. So snake venom is really, really a complex mixture, and as I say, potentially the most difficult or complex drug target known to man. To create some kind of order in this chaos, you could say, to figure out how do you actually deal with this. One of the first things that I did, and which is where I would actually kind of thank DTU for my engineering upbringing, was that I had to sort of figure out, okay, how do we select which toxins we need to neutralize? Do we need to neutralize all of them? I mean, snakes, they eat a lot of different things. They eat reptiles, they eat mammals. Not all their toxins target mammalian prey. Some target lizards. Those toxins have pretty much no effect on our system. So we don't need to make antibodies against those. But how do you sort of decide that? How do we select? And one of the most difficult papers that I published was a paper suggesting that if you have a lot of a toxin and it's very potent, it's probably important. And if you have little of a toxin and it's not very potent, it's probably not so important. You would be surprised how academics can argue against that and say that, well, maybe it's really important for some obscure reason that you can't measure or whatever. But I was like, okay, we have to actually start making antibodies. How do we select these things? And part of the reason why nobody had answered this super simple question was that you always inject horses with whole venom. You're not separating the venoms, you're injecting everything anyway. So you'll get antibodies against pretty much everything. So we spent some time on making a very, very simple thing, looking at if the toxin kills a lot of mice per milligram, and if there's a lot of it in a venom, it's important. So that's basically what you need to know. So I've already given the answer that I've been looking a lot into the Black Mamba, but when I started my PhD almost 3 years ago, I was kind of sitting, which snake should I choose? I could choose the one that is most venomous. I could choose the one that kills most people. I could choose one that is available to me. It's probably a good idea. It's pretty difficult to develop an antivenom against something you don't have at hand. But really what we sort of discussed was it has to be, of course, of medical importance. There's no point in making an antivenom against an irrelevant snake. We have to be able to get the venom somehow. I mean, I'm not Steve Irwin, at least not yet. So I'm not going to go out and actually catch the snakes, unfortunately. Yeah, we were thinking about these different things, but we're also thinking about what we kind of call fear factor. How can we create a good story that people want to listen to, so they want to donate a PhD scholarship and actually believe in the project? So we didn't really know anything, me and a particular guy called Michael, when we set out. But one of the things we could sort of read was that if you divide snakes, the venomous snakes, into two groups, like the two main groups, you have the vipers that many of you know. That's like the hookworm. It's like rattlesnakes and many other snakes in that category. That's the classical snake with a triangular head, long fangs. And then the other group, elapids, where people haven't heard about elapids typically, but you've heard about cobras and mambas, maybe sea snakes, maybe coral snakes. And they're fundamentally quite different because these elapids, they have systemic neurotoxicity. That's what the venom causes. So it's primarily one main effect typically, whereas the vipers have much more complex venoms. They cause both local tissue damage, they cause problems with the blood, as you saw before. They also sometimes cause neurotoxicity. So from a technical viewpoint, it would be difficult to get proof of concept, because we'd have to have many different antibodies against many very different toxins. Whereas we tried to sort of find a snake that was fairly important, fairly known, feasible, and so on. So yeah, and even before going into the Black Mamba, sorry, I forgot there was one extra slide. One thing you have to take into account. Many of you, when you think about the typical question I get when people ask me is like, how quickly do you die when you get bitten by a Black Mamba or whatever snake? And you really can't say, because a snake bite is a typically quite sort of surprising event to most people and prey. And a snake will not be trained in any type of medicine. It won't give you an intravenous injection. It will bite you somewhere in the ass or in the foot or in muscle tissue or whatever. So, and it might not have a perfect bite, because typically you will, pull your arm and it will break a tooth, and maybe part of the venom goes outside and so on. But what is important to think about is when you're bitten by a snake, it's typically not directly into the blood. So there will be a so-called depot effect, meaning the toxins will be located locally in some tissue. And if they function locally, your antibodies need to go out there. That's actually pretty difficult for some antibodies. So we sort of focused more on these systemic effects, where you would have the benefit that you just need to get antibodies into the bloodstream and intercept the toxins before they reach whatever target they go for. So we chose the Black Mamba. And I thought, that's a pretty known snake. How many of you have heard about the Black Mamba before? Just kind of raise your hands. Don't. I'm not going to force any of you. And there's even some people lying that say they've never heard about it before. But pretty much everyone knows the Black Mamba, either from Kill Bill or from Animal Planet or something. It's probably the most notorious snake. It's also the snake that I would least want to meet if I was out hiking. Herpetologists, that's real sort of snake biologists, they say no snakes are aggressive. I would say the Black Mamba is then very proactively defensive. It can grow 4.5 meters in length. It can raise half up, so it basically means that I would be sort of looking up and it could bite me in the head. It's territorial. It runs way faster than human beings. It always injects venom when it bites, and it always bites more than once. So you're pretty screwed if you get in the path of a Black Mamba. And I thought, with this kind of huge snake that has created a lot of public interest in both in fiction and all sorts of other places, surely the venom must be known, but it was not. The venom, nobody really actually, there were a few toxins that have been taken out and been investigated for their properties on ion channels and so on, but really no one knew what the venom from the Black Mamba, one of the most known snakes, consisted of. So unfortunately, I had to fly to Costa Rica, where they are experts on analyzing snake venom and where they produce antivenom the old way. So that was one of the first things I did in my PhD, go to this tropical paradise, where my lab or my office kind of looked like this, at least on the good days. And what I did there was, I didn't collect the venom from the snake. I could fortunately get the snake from a collaborator in France, but took the venom, used HPLC and STS-Phage, that's chromatography and advanced filter, split it up in different ways to sort of figure out what are the different components. We would do what is called Proteomics, which is basically you take out each component, you chop it up with an enzyme, you do MS, mass spectrometry, where you can sort of get you could call it a protein mass fingerprint, or peptide mass fingerprint. We can, by how it's cut up and what the masses are, you can sort of deduct that back and figure out what was the sequence, which is pretty smart. And from there, combining those two things, you can kind of assemble one of these venom proteomes, as you saw earlier, where you figure out how much is there of the different toxins and what are their identities. Then, this system was already kind of in place. They already did that, but I brought a one minor thing in addition, bringing this from what they call venomics to toxicovenomics. Because I really wanted to answer, out of those different toxins, which ones are the medically important ones? So unfortunately, I had to kill some small myces and test all the different toxins to figure out how potent are they. Combining those two things, how potent and how much is there of each toxin, you can kind of tabulate a score and rank the different toxins on how important are they medically, which ones is the most important and which ones are below any medical importance. And from there you could sort of select which target should you then work on. And I did this for 5 different snakes: green mamba, black mamba, the sea snake. If any of you have been to the blue planet, den blå planet, it's their snake, Nessie. I was actually part of milking that one, and I was actually holding the most dangerous part, which most of you think is the head. But for sea snakes that are very defensive biters, it's actually the tail, because they won't bite, but they'll definitely shit all over you. So don't wear your nicest tuxedo when you milk snakes. And then 2 different cobras, forest cobra and monocle cobra. But if we go for the black mamba, just that one, a typical chromatogram, which is the first step of separation, will look sort of like this. You will have, every peak will have at least 1 toxin, typically 2-3 toxins in it. You will be able, those of you who are used to looking at an SDS page, you will see that there's multiple different bands, which means there are more toxins in each peak. I would test the different peaks and see some of them have no medical relevance, which is really nice, because then we don't have to develop antibodies against those, whereas others, particularly these peak 4 to 8 and 20, those are medically important. Those we do need antibodies against. So overall, the black mamba venom contains 2 big protein families, or 2 toxin families. They're all neurotoxins, but the neurotoxins that cause paralysis, but also those that cause involuntary muscle contractions, as you saw the mice earlier. And the sort of the first type, the alpha neurotoxins, they go in, they target these receptors causing paralysis. They inhibit the ion channels, basically. And the others, more schematically, they target potassium channels, which will lead to release of acetylcholine, which is the neurotransmitter, forcing your neurons to start muscle contraction, so you will get sort of the mice in an excited state. In addition, black mamba venom shows signs of vasodilatory effects. They have small nucleosides that are not really toxic themselves. Nucleosides are the things that are part of DNA. Adenosine is one example. And I don't know how well this describes it, but if you have the normal case where you inject a certain amount of venom, after a while nothing happens, after a longer while some mice die. If you have what I call auxiliary effects, which is like speeding up the venom because they dilate the blood vessels, causing increased blood perfusion, increased access for the toxin to target its things, you basically just speed up toxicity. It won't be more toxic, it'll just be sped up. Whereas the last case, where you would look at synergistic effects or increased toxicity, would cause a larger number of deaths. So the black mamba actually has both of those things. It both has these auxiliary effects. It also has toxin synergism. It has particularly, I would say, this thing where you have your, what do you call it, your musculatory system here, and it affects different pathways leading to synergistically enhanced inhibition of that. So it's actually a really nasty, tough neurotoxic venom that works really fast. So I looked at that, and I was done in Costa Rica. I had to go to the next stage, which was sort of then finding the antibodies against these toxins. I didn't need to go that far this time. I could go to Cambridge in England, which is not as tropical, but also quite nice. And it was a very serious time, as you see. And there I worked with a technology called Phage Display. And Phage Display is a really robust and cool way of finding antibodies fast. You make use of bacteriophages that have an antibody. Well, the tip of the antibody, you have a gene for that inside its phage genome. It displays that tip of the antibody on the outside, so you have a link between genotype and phenotype. And what you do is you create libraries where they have different antibodies displayed. And when you have those libraries, you can take your toxin, you can stick it on a plate, you can pour out your library. Some of them, if they have the right antibody, will bind. Some won't. Those that won't, you wash away. Those that bind, you elute. You amplify them because they're bacteriophages, so they grow easily in E. coli. And then you can either repeat it and then concentrate the absolute best binders, or you can sort of analyze them in different ways, with ELISA being the most typical one. And the quite nice thing about this is you can create libraries that are more than 10, that have more than 10 billion different antibodies in them. That's actually quite a lot. So you can do such an experiment in 5 days and basically screen 10 billion antibodies. That's quite impressive. Yeah, now I don't know how many details I want to go into, but typically then what you do is you cut out the gene, you put it into E. coli, and then you can produce the different fragments. I did that and typically got hit rates if all these things that are to that side in the histogram are hits. We would typically get hit rates of about 80% hits of what we found, which is quite nice. Yeah, skip this. But these different antibody formats that exist in the world, the tips are one. But are they the best format for treating and envenoming? And I think for that you have to go back and think about what is a snake bite. It's something that happens typically in distal tissue somewhere. It may be good to have a small molecule that can penetrate muscle tissue or fat tissue more easily. But on the other hand, what we're looking at is these neurotoxins that have to reach circulation, in contrast to the one that says PLA2 is a locally acting one. So we're mainly focusing on the neurotoxins, where I think the right format is the human IgG format. In contrast to all the other antibody formats, it binds just as well, and it has a very long half-life. So it will actually stay in your body for 3 to 5 weeks. So even though when you're bitten by a snake and the toxins will leak out from the bite wound over a course of hours to several days, you will still have sort of protection for a long time. Whereas with these other formats that have a half-life of down to 20 minutes or a few hours, you will need to stay at the hospital. You even see patients that are treated with existing antisera that are treated so that they only have the fat fragments. They get cured of their envenoming, they go home. The next day they return to the hospital because they have a renewed envenoming because toxins have leaked. So we're working a lot on this IgG format, and we have a smart way of sort of on a genetic level converting the single chain fragments to this IgG. So the thing we've been doing this winter, which is quite exciting, back in Costa Rica, the luckiest of all my students are very lucky, but one of them that is particularly lucky had to go to Costa Rica and test things in mice. So I've developed some of these human IgGs against specific toxins from black mambas and cobras. They're actually the first time someone has ever developed a human antibody against a toxin from any venomous animal. So it's very exciting. But in essence, we test if these antibodies and also mixtures of them can neutralize several toxins and keep mice alive. And the good news is it can. So just to give you some quick results, we tested, I think 9 against a specific toxin and found that many of them, they do prolong survival, but there's particularly one that, and then 60 minutes is enough for this test. You know, if it survives 60 minutes, it's going to do fine. We have particularly one that at quite low doses provide full protection against at least this toxin and a few others. We have similar results for another toxin. Some provide prolonged protection, but there are particularly one, this is ours, this is a slightly different test for this toxin, but that provides full protection at very low doses. So we are quite excited that this whole sort of process of looking at snake venom, splitting it up, figuring out what are the medically relevant toxins, using Phage Display, which is really a fun way or weird way of simulating the human immune system and selecting antibodies, converting them to their proper format, and actually testing them in vivo and getting them to work. Quite excited about that, and we'll hopefully very soon publish it. So this is pretty much the research that I want to present. I'm going to switch a little bit soon to how PhD and postdoc life is. Before then, I'd like to thank particularly the professors Bruno Lamonte and Jose Maria Gutierrez from Costa Rica that are some of the absolute best people that I've worked with. They are so sympathetic and hardworking and dedicated to science. My old PhD supervisor, Brian Lose from the University of Copenhagen. My new mentor here at DTU, Michael Rørdam. And then both Anish and John from Iontas in Cambridge. I was actually very lucky that John, he's the guy who invented this phage display technique. And maybe you might not have heard about phage display, but maybe some of you have heard about Humira, the most selling drug in the world. No? Sells for $15 billion. He used that technique together with other guys to develop that and became at least a billionaire in Danish kroner. So he's been a big personal supporter of the project as well. And in general, yeah, these guys have been quite instrumental to everything. So that's sort of it for the science part. I'll spend a few minutes on how did my life sort of, or why did I sort of end up in this pathway, just very brief, and then I'll change so that it could be a bit more interactive. But when I was sort of doing my master thesis back in 2000 and early 12, I was actually working on a side project together with Hans Gené, Mathias Munk Mortensen, and Jens Ries called Biotechnological, and I think some of you may have heard about. Now it's a company and so on. So we sat there back in 1864 and discussed on how to make a business plan and all sorts of different things. And I was quite interested in biotech entrepreneurship and so on, and spent 1.5 years. Well, in total more, but I spent 1.5 years after I finished my master's on helping to develop this company and participate in many different competitions and so on. And because I did that, I was offered to co-found something called Rebels that, for those of you who are interested in entrepreneurship, I would also recommend you to look into. It's not a student organization, it's a sort of a young professional organization. So when you're done with your studies and you've been to Venture Cup and so on, you kind of move into the teenage club of Rebels and talk about different things. And because I was part of Rebels, I had sort of a challenge that I hosted where I said that people here are so smart that in 6 hours they can definitely come up with a better idea than what is currently in Venture Cup and win the competition and so on. And that's the first time where I actually presented this idea of creating recombinant antivenoms. And I had my colleagues Jens and Mikael and Guillaume. They got excited about it and we worked for these 6 hours, made a business plan, obviously did well in Venture Cup, and ended up working further on it, and within half a year started a company. Guillaume changed name to Alexandra, or the person, well, he had other things, and Alexandra was brought on board. And we worked for quite a while in this team. This is Alexandra. In various different places. Been lucky to be part of a lot of different competitions, which was a lot of fun on the way on creating a company. And we made a more serious business plan, or at least a more sort of in-depth one, and continued to participate in different things, won a few different awards and so on, and which is good to at least bring some kind of traction to your company. When you're young, you have no scientific publications, you have no expertise in reality, you really have no idea what you're doing, so winning a competition make some people believe you potentially may know a little bit, because it takes time to get a sort of a respectable research background. It's hard work. Yeah, a few other things. But at some point when it was, this was about half a year into the project, we had, can't actually remember if we registered the company, I think we had. But Michael was going to do a PhD in something really boring, and I was going to do a really awesome PhD in some cancer stem cell research, but I thought actually, cancer, you're going to be a drop in the ocean as a young researcher. I had some different ideas that were probably fine, but with Snakebite I could actually really make a difference. A single person can make a huge impact on the lives of a lot of people because it is such a neglected disease. It also spoke more to me that it combined evolutionary theory. My interest in nature spoke really strongly to that. It was more about engineering things, about creating drugs, not about looking at stupid cancer cells that never want to grow as how you want them to do. I did a little bit of cancer stem cell research, and they're really nasty, or not nasty, they're just difficult to work with. So I convinced Michael that we should skip those PhDs that we had set up and do Antivenom instead, and actually do what we talk about. And now I'm going to switch to sort of talk about what are the other alternatives. So for some reason in Denmark, and for some reason particularly at DTU, people, they have this idea that doing a PhD, going to industry, what is best? And it's really not a comparison. This is your first job in industry. That's what you'll do. You'll do the most shitty work in a company. You'll have the most boring time. You'll advance at some point, yes. But it's really not the most fun job. It's also not the most well-paid job. Other examples are like this. These are young biotech engineers, I'm sure. But extending your studies, sort of say, it's not really extending your studies, but actually doing work together with other people your own age that are actually passionate about what they do, that like to drink beer. Not all, and I'm sorry to be an ageist, but not all lab technicians 45 want to drink beer Friday night with you. And most PhD students want to do that. And most people in the industry are not that excited about analyzing water samples or doing QA or whatever. So, I mean, I'm a big spokesman for doing a PhD because as part of my PhD life, first of all, they paid better than an industry job. If you count in scholarships when you're studying, it pays way better. That's not why you should do it though, but the reason you should do it is because it will actually bring you a lot more adventure. It's okay to be in Ballerup and Bagsværd, it's fine. Nicaragua is better, Costa Rica is also better. It's at least more adventurous, in my opinion. So in my, as I already told you, I had to go to Costa Rica, do stuff, met some quite fun people. Had to go to Cuba, do for very important scientific meetings, of course. And yeah, you know, also trying to sort of engineer a what are these things called? They don't work as submarines, just FYI. It was not a particularly wise decision. I think it was actually Anders, who did not do a PhD, who's out in industry. He chose to make this into, so I would obviously never have done that. Later had the opportunity to go to Cambridge, spend time there, which is also a wonderful place where they're a little bit more serious than Costa Rica. The thing is, you have to provide resources, typically yourself, to have a good time. Many PhD positions are maybe a little bit underfunded, which is a big problem these days. But if you can provide resources, it'll make your life nice. Particularly in our group, we typically go to Snakebite Academy, which is on Mallorca. And as you see, study very important scientific content like CRISPR. And basically, I spent 2 years on that and handed in my PhD last May. This is actual footage. And since then, been lucky to live postdoc life. And a thing that is, of course, my personal life, but a thing that your PhD will give you the opportunity to is to actually meet a lot of other people from a lot of other countries. Whether you are in Denmark, there will be a lot of foreign PhDs. I think half of the PhDs at DTU are foreigners. You will also go on exchange, at least if you want to. And like I've become good friends with particularly this guy Anish, who's Indian, and had the pleasure of spending my Christmas and New Year's this year at his wedding in India, which was pretty nice. Later, I was in Miami together with, you see, Michael is also doing a PhD. For those of you who are unfamiliar with those two, that's Jerry Harrison from Talking Heads. Talking Heads is in the Rock and Roll Hall of Fame. U2, which probably rings a bell, at most used to open for them. So they're larger than U2. So, you know, most of my time goes with spending time with rock stars, going to exotic places, giving talks and all this kind of things. And it's actually quite enjoyable. I mean, my main point is it's not about rock stars in reality, but the thing that I really enjoy about doing a PhD is you get a project of your own. You actually get something that you're hopefully quite passionate about that will bring adventures. And most important of all, other people are actually interested in what you do. Your life matters suddenly. It's not like when you analyze water samples. I mean, nobody cares. It's nice, it's important. It's not that it's not important to analyze water samples. It's very important. It's just not so fun. One thing for particularly the young gentlemen in here, a warning. So there's been a lot of focus in recent years that women are taking over science, and then there's the opposite thing, that all professors are men and so on. But women are taking over science. And one thing that I just want to warn you about, there will be a lot of sexism. So when I present people, they mainly focus, like this is official tweet from Doctors Without Borders when I gave my talk in Oxford last year, mainly focusing on my looks, not on my science. So that's of course for all the men in the audience. You will be sexually harassed and all sorts of things. In any case, today I've been lucky to be at a point where we sort of started this junior research group, the Tropical Pharmacology Lab. If you Google tropical pharmacology, we're the only people who use that word, I think, so far. So you can probably pretty easy find it and read about our research and so on. And yeah, the last thing I don't care about, we'll skip that. And then the very last thing that I kind of want to end end with before we sort of open up, and I've already spent a little bit too much time, is if I look back at some of the things that I did right, but also look back at some of the things I should have done, some of the things I didn't do all the things on this list, but some of the things that has really sort of been beneficial for my own career and to bring me to where I am today and bring a lot of adventure and more importantly very cool projects and very cool collaborators and co-founders and co-workers has been to engage in extracurricular research projects, in general extracurricular activities. I mean, all of you are actually doing that today, so that's good, to participate in things like SBE or other things. That's also the professional network part. Generally, I would really recommend going abroad if you haven't done so already. It just brings in more perspective, and you get to meet people and have friends all over Europe or the world that you can gate crash and just sleep at their place and have cheap vacations for the rest of your life. Really nice. And then participate in some of these different competitions that are around. First of all, they are extremely fun to be part of. You learn a lot, and they also look nice on your CV. I would definitely spend more time on that than spending time on paid work. I mean, the reason why people pay you to do a job is because nobody wants to do that job. So they need to give you something to do it. So that would be a pretty boring time. Yes, you will get a little bit of money, but that money is really, really nothing compared to what you'll earn in your whole life. Do any of you know what are you projected to earn? Is it more than 10 million, more than 100 million per year? It's about 50 million, yeah. So whatever you earn on the side as a young student, those few hundred kroner per week really don't matter in the big picture. It's more important on how you optimize your career, in my opinion, not just for monetary gain, but actually have a career that is interesting and that you enjoy. There's a few other things there that I would, maybe the one that I would highlight most is that a lot of the great opportunities, they don't look great the first time they're presented to you. Somebody will say, hey, do you want to come and work on this for free? And we have this basement, and yeah, I have an empty beer, a case of beer, you can sit on that, and so on. It doesn't really sound too attractive compared to, hey, you can come and analyze water samples. We have really good coffee here in Bauswerd. Sounds maybe a little bit okay. Be a little bit more adventurous and reach out to other people, and then be a little bit selective on how you spend your time. A lot of people, they complain. Well, I've heard at least complaints from different people where they sort of say, why don't I ever get sort of interesting, fun experiences or opportunities? Why did you get an idea? I never get ideas. Well, the main reason why I don't get ideas is because you do pretty much the same thing as you do every day. Spend this time with people that you have seen all your life. There's not that many new things that come up. If you force yourself to exit your natural habitat and do something else, most people, at least most engineers, they suddenly get creative and think of ideas and things to optimize and find problems that no one has found before and so on. And then I would really also say, don't use as an excuse that your boyfriend or cat or pet lobster or something needs you. I mean, they really don't care, most of them, including the boyfriend, if it's about going abroad. And if they really do care, is it really the cat you want to be with? Every opportunity comes with a slight sacrifice. Whenever you choose to do something, you choose not to do something else. You can, of course, choose to stay with your pet lobster, but then obviously you probably won't get so many new friendships or ideas or experiences. So, yeah, I would end off with saying, don't go home early, whether it's this meeting or any other thing. Spend your time on meeting new people, meeting new opportunities, and then be selective and also able to say no. Thank you very much for your attention.
Thank you, Andreas. You guys must have some questions about snake bites or entrepreneurship.
Or life.
Or life in general.
Science, life science.
PhD life.
Yeah, so the question is if it was easy to get DTU engaged in the idea. I actually did my PhD at KU. To be honest, it was easy to get them interested. It was not so easy to get funding. And that has unfortunately not changed for the better since then. I think that will be a struggle for quite some years. In general, if you have your own idea that you want to pursue to do a PhD, probably the best thing to do is find a professor who's doing something similar, or at least working in the field, and make a plan together with them on how you actually get the funding for it. That was basically also what I did to some extent. It is difficult. It requires more. But the reward is that you get to work on your pet project or whatever you're passionate about. So I wouldn't discourage anyone, but I would also be honest and say it is going to be more hard work. It's easier just to apply for an existing PhD position, which will probably also be okay.
Anyone else?
Yeah.
How do you immunize a horse without killing it?
Well, you don't have to inject all the venom. Inject very small amounts to start with, and then you build up. It starts building up immunity, so you increase the dose over a course of 1.5 years. It's like vaccination, basically.
Does that mean that if you get stung by bees about once every year, you will become more and more?
You will.
Yeah.
You will become more and more resistant now. With bees, my understanding is I've looked a little bit into their venom, and it's really not that immunogenic, or at least not. It doesn't have very good B cell epitopes, which is what is required to create good antibodies. It's a very small toxin, so it's immunogenic in causing an IgA response. And without going into too many details, you can get anaphylactic shock if you are prone to that. They are actually, I think it's on the market now. They have made a vaccine, an oral vaccine. I think it's Alcabello that have done, a Danish company. In theory, yes. If you got stung a lot, you would. But there's some things that are easy to build an immune response against, and there's no correlation whether it's the most toxic things or least toxic. Immunogenicity and toxicity are in reality two very different things. Yeah, so for mammalian prey in general, or mammalian victims, actually mice are quite similar if you look at their central nervous system. We all use acetylcholine, all mammals, but as I said, lizards are different. They actually don't use acetylcholine. I think they use GABA, or I'm not entirely sure, but they use something different as a neurotransmitter. There's a good correlation between mice and humans, typically, with venoms, snake venoms and antivenoms. But it's a very good point, because there's not always necessarily a good correlation. If you take in a honey badger or a mongoose, desmodyr in Danish, the correlation would be awful, because those particular species have actually changed their receptors so that they are more sort of resistant towards snake toxins. So it is important to look at what species and how the specific species react. Actually, the funny thing is the toxins. Many years ago, they tested a lot of different toxins on snake venom from snake venoms on mice. They had the regular strong ones, and then they also have some called weak neurotoxins in mice. The reality is these are not weak neurotoxins. They are actually way more potent on lizards than the corresponding toxins are on mice. They just don't work on mice. They work a little bit, but they were weak in that case, but they're actually super, super, super potent, but just on a different species.
Any more questions? No? Yep.
Yes.
Yes. Let's hear it.
Yes. So vaccination is typically something you do not to protect the individual, actually, but to protect the horde or the herds. That's the reason why we have vaccination programs in the West, is basically not to spread diseases and have entire populations wiped out. That will not be the case with snakebite, despite that there may be many snakes and bites. It's not contagious. Once you're bitten, you won't. Other people won't contract the snakebite from you. Technically, it could be done, but it takes a 1.5 years of vaccination for a horse to build up immunity. My guess is it's going to be about the same for a human, continuous injections. What are the chances of being bitten by a snake? And it's not, snake venoms are quite different, so it's not, you would need a very broad spectrum. So I think for snakebite, vaccination is not really the strategy you want to go for. It would be quite expensive to vaccinate everyone, and it would only be 1 out of 1,000 in even the worst places that would be bitten per year. So it would be cheaper to make antivenoms, and I would also have my doubt on whether you would be really able to build up a super strong immune response so that you would not need treatment at all. My guess is you would probably still need some treatment. But you would people have been doing this in different societies around the world. I think on Borneo, as far as I recall, there's been a tribe living out in a very snake-infested area that have been performing self-immunization, more controlled, and let snakes make controlled bites, 8 times, and allegedly they survive more. I don't know if it's true. A lot of things that happen within snakebite and all the different things regarding snakes are often based on beliefs. There's also a case reports from India that heavy heroin addicts, they switch to snakebite. That they go to a local snake charmer, they stick out their tongue, he comes with a small cobra, lets it bite their tongue. They become lethargic, very sleepy, and they sleep for something like 17 hours, and they wake up and they claim to be cured of their heroin addiction. They're at least willing to pay 10 times as much to get snakebite instead of heroin. Some snake venoms, I know one of my colleagues from Australia, he's been bitten 17 times by snakes, and most of them just hurt. But there are some that actually cause hallucinogenic effects. Some of it is really hard to say. What is placebo effect? What is superstition? What is actual effects?
Yeah, I saw something about a guy in America. He was a little bit cuckoo, but he had snakes in his backyard, and he let himself inject with the venom, and he could take like 5 or 10 times.
Yeah, I think it may be Tim Fried. I think he's called. He lets a black mamba bite him, and he does it on camera, and it seems to be legit. I would not recommend that. Let's just say. But yeah, it is. I'm actually considering reaching out to him because it would be interesting to look at his blood. I have a different guy in England. He's of course American, who's also been self-immunizing with snakes for 30 years. And for those of you who have access to BBC, there was a documentary about my work on him about a month ago. And basically this guy, he was just fascinated by snakes and wanted to self-immunize and experiment. Rock musicians, either they play good music or they dress up or something. And I don't know. But in any case, he wanted to experiment with this. It's sort of a what would you call it? Recreational use of snake venom. He says it's like eating strong chili. You don't get high from that, but you do get a kick. And I've been looking into his blood, and was it 2 years ago? None of these young new guys have tried it yet, but at our Christmas party in the Tropical Pharmacology Lab, I had my friend who's a doctor come take blood samples, and then we tested who had the best antibodies against Black Mamba. So we had like Black Mamba Survivor 2014. Steve, the rock musician, he always wins. So he has immunized and does have an immune response, but I don't. I also tested his antibodies in pure form. He's not an antivenom machine, so to say. He has a strong response, but there's still further to go if you want to create a real antivenom. You can't just take his blood and use that.
All right. One more.
There's a lot of uncertainty regarding that. Part of what we would need to do would be to find a few more antibodies that we are on our way to that. How far are we from testing any of the stuff we do in humans? So a lot of it depends on funding. In order to test something on humans, you would have to produce these antibodies in GMP standard, sort of the highest quality and with some kind of regulatory approval. And it's really costly to make a batch. I mean, it's money that we don't have at the university, at least not now. So part of it is, the strategy is to have really strong science, good results in mice. And the good thing is, if you have good results in mice, they are really transferable to humans. A lot of the problem with transferring results on different drugs from a mouse to a monkey to a human is typically you target a mouse target or a human target or a monkey target. In our case, it's the same target whether we inject the venom into a mouse or a human, or it's still snake venom we're targeting. So you're not changing the target when you change species. The reaction might be different. I don't think a human would run around as a mouse does when it gets dendrotoxins, but you definitely get involuntary muscle contractions of some sort. It might look a bit different, but it's unlikely that it won't be, that if you show efficacy in mice, that you won't have efficacy in man. When you're there, we are dependent on philanthropic funding for someone actually paying for a batch, dependent on someone doing an actual clinical trial, which is also why I try to keep contact with Doctors Without Borders who operate down in snake-infested areas that can help advise on how to go about. Because what we are actually doing is that we're not just developing a new antivenom, we're actually completely changing antivenoms from being serum-based, from being blood products, to becoming pharmaceuticals. So in reality, we're kind of developing a drug in an area where there is no drug. There's a blood product, there's no drug. So how that will be dealt with regulatory-wise and clinically is not so easy to say. It requires a lot more discussion, at least, with the right people.
Thank you. I think we'll end here. Oh, last one. Yeah. Let's take one last question.
Yes, so what I've done different in my research here than what I did in Biosyntia. So in Biosyntia I didn't do research, so that was actually Hans's and Morten's domain, whereas I was responsible for business development, making a business plan, looking at business cases. In Biosyntia we develop biocatalysts or bacteria that can produce different food ingredients cheaply and sustainably. And my role there was basically figuring out where does it make sense for us to apply our science, where is the business case, and go out and talk to potential collaborators, go out and pitch at different competitions, talk to investors, also all the basic stuff, making a website, accounting, legal things. When you're a small company, I mean, that's, in a way, it's a good thing is that you do, it's very sort of, you have all hats. You have to do many different things, but it's also difficult because you can't be an expert in all of it, and you will typically have many questions you can't answer yourself and have to reach out to either consultants or advisors or different things. So here I've been doing all the research I presented here I've done myself, I think. Well, except the actual last testing, the student did that. Yeah, so now it's more about designing experiments and being supervisor of some of the people here that you can ask how evil I am and how much I drive a slave farm and how much it's a tropical paradise on Mallorca. Yeah.
All right. Thank you guys for...
I think maybe one final... I think they mainly drink beer and take time off and go to different things, go travel around and so on. I haven't seen any of them in the lab. It also doesn't make it easier that I'm not in the lab, so I don't know if they actually do anything. They tell me that they do. No. I think what you guys have been doing, most of you have been this Phage Display they've been using. They have been spending a lot of time. I'm of course joking. It is in a sense just molecular biology. It's specific, of course, experiments and techniques, but actually finding antibody hits. And you're all at the point where you're just about to have a breakthrough, I can feel. We will next week have results on whether it has actually been successful the last few months. So it's using these bacteriophages, these viruses, growing E. coli, testing antibody fragments. If we have good antibody fragments, we'll start converting them to this human IgG form and produce them, and maybe someone gets lucky to go to Costa Rica and test them.
All right. If you guys have any more questions, feel free to come up and ask Andreas afterwards. I think it'll stay a couple of minutes. But let's thank Andreas and thank you guys for coming out. Great to see you. And don't forget to like the SBE Facebook page and show up for our next event. That will be Biotech in Food Production on the 19th of April. Thank you guys. And we have more snacks over here, so take some with you.